T3, the fat loss weapon in bodybuilding. Mechanism, dosage, benefits, and risks. Introduction. In the world of competitive bodybuilding, every calorie and every gram of body fat matters, especially in the final stages before stepping on stage. While nutrition and training form the foundation of fat loss, some athletes turn to powerful pharmacological tools to accelerate the process. One of the most talked about compounds in this context is T3, also known as liothyronine sodium. Originally developed as a treatment for hypothyroidism, T3 is a synthetic form of the body's natural thyroid hormone triiodothyronine, a hormone that plays a central role in regulating metabolism. In bodybuilding, it has earned a reputation as one of the most potent fat loss enhancers available, but its power comes with significant risks. 1. What is T3, liothyronine sodium? T3 is the active thyroid hormone that the body produces naturally in the thyroid gland. It is far more metabolically active than T4, thyroxine. In medical use, it is prescribed for hypothyroidism, certain thyroid cancers, and diagnostic purposes in endocrinology. In bodybuilding, it's used off-label to increase the metabolic rate and accelerate fat loss. 2. How T3 works in the body. T3 binds to nuclear thyroid receptors inside cells, increasing the transcription of genes involved in metabolism. It increases the number and activity of mitochondria, boosting the rate at which cells convert nutrients into energy. The result is higher basal metabolic rate, BMR, greater calorie burn at rest and during activity, increased fat oxidation, use of stored fat as fuel. However, it is non-selective. It speeds up all metabolic processes, including muscle protein turnover, meaning it can cause muscle loss if not used carefully. 3. Why some bodybuilders use T3. Contest prep, when extremely low body fat levels are required and progress has slowed. Stubborn fat areas, to mobilize fat that is resistant to diet and cardio. Short timelines, when rapid fat loss is necessary. Synergy with other compounds, often stacked with anabolic steroids to preserve muscle mass while burning fat. 4. Common dosage protocols. Athlete anecdotes, not a recommendation. Warning: this is for educational purposes only. Medical supervision is essential. Misuse can cause permanent thyroid damage. Starting dose: 12.5 to 25 mcg per day. Gradual increase. Many increase by 12.5 to 25 mcg every 3 to 4 days until reaching 50 to 75 mcg per day. High-end use. Some competitive bodybuilders go up to 100 mcg per day, but this greatly increases side effect risk. Cycle length. 4 to 6 weeks is common. Longer cycles raise the risk of thyroid suppression. Tapering off. Users typically reduce the dose gradually over 1 to 2 weeks to allow the thyroid to resume natural production. 5. Benefits claimed by bodybuilders. Accelerated fat loss. Noticeable increase in daily calorie burn. No dependence on training intensity. Works 24/7 even at rest. Enhanced cutting results when combined with calorie deficit and cardio. Synergy with clenbuterol. The two are often stacked for maximal fat burning. Reduced prep time. Helps athletes achieve contest leanness faster. 6. Risks, side effects, and dangers. T3 is one of the most powerful metabolic hormones. Misuse can cause lasting damage. Muscle loss. Unless counteracted by anabolic steroids, T3 will burn muscle as well as fat. Thyroid suppression. High doses or long use can shut down natural thyroid production, potentially permanently. Heart strain. Increased heart rate, palpitations, arrhythmias, and in severe cases, cardiac hypertrophy. Nervous system overstimulation. Tremors, anxiety, insomnia. Excessive heat production, sweating, intolerance to heat. Bone density loss. Chronic overuse can contribute to osteoporosis. Metabolic rebound. Abrupt cessation can slow metabolism, causing rapid fat regain. 7. Ethical and legal considerations. T3 is a prescription-only medication in most countries. Off-label use for physique enhancement is not medically approved. Possession or use without a prescription can be illegal. Ethically, its use in tested sports is banned by WADA, World Anti-Doping Agency. 8. Practical, best practices claimed by experienced athletes. Not medical advice, purely reporting common bodybuilding anecdotes. Always start low and increase gradually. Stack with anabolic support to preserve lean muscle mass. Avoid very high doses unless under medical supervision. Keep cycle lengths short, 4 to 6 weeks. Maintain high protein intake to protect muscle tissue. Taper down the dose to avoid metabolic crashes. 9. Conclusion. T3 is often called the nuclear option for fat loss in bodybuilding, and with good reason. It is one of the most effective agents for accelerating metabolism and burning fat, but it is also one of the riskiest. The line between an effective dose and a harmful one can be thin, and misuse can lead to permanent thyroid damage, muscle loss, and cardiovascular problems. For these reasons, T3 should only be used under strict medical guidance and only when the benefits clearly outweigh the risks. In bodybuilding, as in medicine, the most powerful tools demand the most respect.